Hello, I'm Dr. Barry Pecos, York Region's Medical Officer of Health. As we move more decidedly into the fall and move inside, many of us are finding that we're becoming ill with garden variety colds, some more severe and some may be COVID. With high levels of COVID vaccination in the community, most people are not becoming severely ill, but we still need to keep in mind those who are most vulnerable. This may mean choosing to wear a mask in an enclosed setting or making that extra effort to keep up to date with your COVID vaccines. You can make a difference for yourself, for your loved ones, and for the community. As you know, one of the last areas where COVID-19 measures applied outside of hospitals and clinics was in airports and other areas related to travel. These measures have now been lifted as of October 1st, meaning that it's up to each one of us, now more than ever, to act thoughtfully and considerately to protect ourselves and our community. In exciting news, the bivalent booster is now available to anyone over the age of 18 who's had their initial 2 doses. The bivalent vaccine works in the same way as the original booster and is the added element of protection to fight against the Omicron variant. Immunity from the vaccines and from the boosters wanes over time. So if it's been 3 to 6 months since your last dose of the COVID-19 vaccine, book your appointment now to receive your bivalent booster at york.ca/COVID-19 vaccine or call Access York at 1-877-464-9675. We are seeing our York Region Public Health clinics book quickly, so make sure to get your spot as soon as you're eligible. Parents and caregivers of children aged 6 months to 5 years who've not yet received their COVID-19 vaccine should book an appointment as soon as possible. With the province now supplying us with pediatric Pfizer vaccine for this age group, as well as the Moderna vaccine, we have both available in our clinic and both are great choices offering optimal protection. With many kids in school for in-person learning, these vaccines will protect your children from severe illness and lost time in school and with friends if they come in contact with COVID-19. If you want to learn more about COVID-19 vaccination options, you can visit york.ca/COVID-19 vaccine info. Omicron continues to be the most transmissible variant in York Region and globally, and it continues to be the dominant variant in our wastewater. There have been new subvariants identified globally and locally in Ontario, but none have been identified as significantly more transmissible or significantly more severe. This is good news, but we still aren't out of the woods yet, and we are monitoring carefully. Hospital admissions and institutional outbreaks are stable. Again, tentative good news, but we expect and are preparing for a fall surge, which, as I said, is likely to be a combination of COVID, influenza, and other respiratory infections that we haven't seen for the last 2 years. While we're grateful for residents stepping up and doing their part to keep up to date on vaccinations, nearly 50% of adults over the age of 18 haven't yet received a booster, bivalent or otherwise. Keeping up to date helps ensure the vaccine can continue to protect you from severe outcomes, especially as colder weather and the holiday season of gathering is approaching. Please do consider vaccination this fall, especially if it's been much longer than 6 months since your last dose. Lastly, if you do happen to get sick, please stay home. Once you don't have a fever and your symptoms have improved for 24 hours or 48 hours if you've had vomiting or diarrhea, you can consider returning to your normal activities, but wearing a mask for around 10 days since your symptoms first started. I do always have a mask with me so I can put it on should I find myself in close contact with others or around particularly vulnerable individuals. It's an easy way to protect yourself and those around you. All the best.